Now that you've had open heart surgery at Bronson and are starting to feel better, you're looking forward to recovering at home. The goal of this video is to help make your recovery as easy and successful as possible. We'll discuss pain management, incision care, your activity level and nutrition needs, rehabilitation programs, home health care, and the role of your family in your recovery. Plan to make follow-up appointments with your surgeon and cardiologist according to your discharge instructions. A referral to a home health care agency and cardiac rehabilitation program will be part of your recovery. Bronson can service these needs through Bronson Home Health Care and the Cardiac Rehabilitation Program at the Bronson Lifestyle Improvement and Research Center. Typically, incision pain decreases each day after surgery. Tingling, burning, numbness, and itching near the incision are all common complaints for several weeks after discharge. Back pain between the shoulder blades may be relieved by medications prescribed by your physician. Outside factors such as too much or too little activity, sleeping in one position too long, or even a change in the weather can cause discomfort in the incision area. Incision pain tends to be worse in the morning. If so, try to take your pain medication as soon as you get up. Also, it helps to support your chest with a pillow while you cough or breathe deeply, or when you get out of a chair or bed. Many patients find that sleeping in a recliner is more comfortable when they first get home following surgery. If you experience any unrelieved chest pain similar to the pain you experienced prior to surgery, you should call your cardiologist immediately or call 911. Heart surgery patients may experience several other common concerns after their discharge from the hospital. Swelling may occur in the legs where the veins were removed. Elevate your legs while sitting, and several times a day, lie flat and elevate your legs over the level of your heart by resting them on several pillows. Keeping your legs elevated should eliminate the swelling. If it does not, contact your cardiologist, especially if you are also short of breath when at rest and experiencing weight gain. Feeling winded, especially when active, is quite common for 4 to 6 weeks following surgery. Resumption of normal activity and cardiac rehabilitation will resolve this. Decreased appetite for a few weeks, and trouble sleeping for a few weeks. These concerns will be resolved in time.
Incision care is important after you are discharged from the hospital to prevent infection. To accomplish this, you need to keep your incisions as clean and as dry as possible. We recommend that you take a shower every single day. If you do not have a shower, you need to take a sponge bath every day. Until your incisions are completely healed, avoid sitting in the bathtub and soaking. Do not put any oils, lotions, or creams on your incisions until they are completely healed. 2 weeks after your surgery, remove your steri-strips. This is easiest if done while in the shower when the steri-strips are moist. Staples are typically removed 2 to 3 weeks following surgery in your surgeon's office. If you have any signs of infection in your incisions, such as redness, swelling, warmth, drainage, or if you have a fever over 101 degrees, contact your surgeon.
Once you return home, you will want to resume normal activities as quickly as possible. We encourage this, but urge you to listen to your body and not overdo it. Here are some important things to remember. Protect your breastbone during the first 6 weeks following surgery. This bone can take several months to heal. Use your heart pillow when coughing. Do not lift anything that weighs more than 5 pounds. Do not push or pull heavy objects, including vacuum cleaners, heavy doors, and windows. Avoid horizontal movement of your arms and lifting them above your head. Also, do not let someone help you up from a chair or bed by pulling on your arms. Do not drive a car until your surgeon releases you to drive, usually 4 to 6 weeks following your surgery. Do not ride a bicycle, lawnmower, or snowmobile. Your surgeon will tell you when you may resume these activities. Walks are encouraged 3 to 4 times a day. As you become stronger, increase your time, distance, and pace. Endurance varies from person to person. Just be sure to get your surgeon's permission before participating in any recreational activities such as golf, swimming, and gardening. Limit visitors during your first week or so at home. Too many visitors can be exhausting and slow your recovery. Feeling winded with activity is common, so don't be alarmed. This will pass with time. If you seem unusually short of breath or are short of breath when resting, call your cardiologist. Fatigue will become less noticeable as time goes on. If you are having trouble sleeping at night, consider taking your pain medication at bedtime. Your surgeon will increase your activity level as your recovery progresses. Lack of appetite following surgery will improve over the next few weeks. Some nutrition tips to promote healing include: eat well-balanced meals and eat slowly. It's better to eat smaller meals more frequently. Limit your salt-sodium intake. Make sure to take pain medications with food. Weigh yourself daily. If you gain more than 2 pounds 2 days in a row or 5 pounds in a week, call your cardiologist. Long term, you will want to make sure you follow a nutrition plan that is low in cholesterol, saturated fat, and sodium, and follow the dietary recommendations given to you in the hospital or in your cardiac rehabilitation program. If you would like assistance in creating your long-term nutrition plan, Bronson has outpatient nutrition specialists available to help you. Most surgeons prefer to have their patients begin their recovery process in the convenience of their home, with the support of family and the skills of a home health nurse. Your case manager will have assisted you in this process prior to your discharge. Medicare and Medicaid will cover the cost of all home care services that are provided by a Medicare-certified home health agency, such as Bronson Home Health Care. If you have home health care, a nurse will visit you the day after discharge. Home health care nurses focus on monitoring your heart and lungs, assessing the healing progress of your incision, and providing education on medications, pain control, diet, and smoking cessation. They bring high-tech equipment into your home that will enable them to check your oxygen level, heart rhythm, and obtain in-home lab results to assist you and your physician in managing your progress. The nurse will work with your physician to develop a personalized plan of care for your recovery. You will be provided with emergency contact numbers to ensure that you can reach a nurse 24 hours a day, 7 days a week, should you have any questions. As part of your home health care, you may also be visited by a physical therapist and an occupational therapist. Your home rehab program will focus on strengthening, energy conservation, a home safety evaluation, and will assess your need for assistive devices. Once you are discharged from home care, your recovery will continue through our outpatient cardiac rehabilitation program. Adopting a heart-healthy lifestyle following cardiac surgery is essential to your full recovery and getting you back to the activities you were used to prior to surgery. Both diet and exercise are important factors in this, and the process begins soon after your surgery. Cardiac rehabilitation staff will assess your physical, emotional, and behavioral needs. Bronson offers cardiac rehabilitation programs designed to meet the needs of every patient. These programs are divided into 3 stages, the first of which took place while you were still in the hospital.
Phase 2 of cardiac rehabilitation begins the outpatient portion of rehab, where you're continuously monitored as you exercise. During the monitored stage, we check your EKG, heart rate, your blood pressure, and your response to exercise. Phase 3 is supervised but not continuously monitored.
Patients in outpatient cardiac rehab can rely on the expertise of registered nurses, exercise specialists, exercise physiologists, and registered dietitians. You will have use of state-of-the-art exercise equipment, including several types of bikes and treadmills. Heart patients are spending less time in cardiac rehabilitation because of advances in cardiac surgery. Early intervention, less muscle damage, and better anesthesia have all contributed to a more rapid recovery period. The average length of the monitored rehabilitation stage is 4 to 6 weeks. Individualized programs run from 2 to 36 weeks, and patients are encouraged to attend 3 times a week. Many of our patients are happy to participate in cardiac rehab and find additional support alongside others who have experienced similar situations. Most patients say participating in cardiac rehab is the best decision they've ever made. Here are some specific points to remember and concerns which warrant a call to your surgeon or cardiologist. Please call your surgeon if you experience any issues or concerns with your incision. This includes redness, warmth, swelling, increased pain in your incision, drainage or discharge from your incision, separation of your incision, if you run a fever of higher than 101, or if your breastbone feels unstable. Other indications to call your surgeon include if you feel movement in your breastbone, particularly when you cough or sneeze, or if you need refills for your pain medication. Call your cardiologist if you experience dizziness or lightheadedness, if your heartbeat is irregular, if you need refills of cardiac medications, if you experience chest discomfort similar to before your surgery, if you feel angina, if you experience weight gain of more than 2 pounds in 2 days, or more than 5 pounds in a week, if you experience shortness of breath when at rest, or if you have swollen feet, ankles, or legs. And remember, if you smoke, one of the most important things you can do for your long-term health is quit. We hope this video has been helpful to you and your family as you continue your recovery from open heart surgery. Remember, Bronson's entire cardiac staff is dedicated to your well-being. Please do not hesitate to call your physician if you have any questions or concerns.